the intestine. Meaning that if you do a villus atrophy, you collect sample of duodenum for all the animal at the same site, and you can see there is a different internal height, so that we can consider as villus atrophy. But if the sample of intestine is random means they take the duodenum, they take ileum, so you cannot compare the villus height of the duodenum and the ileum, and when the ileum one is shorter, then you say it's villus atrophy. What I'm trying to say here is that villus atrophy, if you compare between duodenum and duodenum, is okay. Your sample is all duodenum is okay, but remember that there's no barrier between duodenum and jejunum, grossly. So the site of sampling is very important. Otherwise, people might make wrong interpretation just because they collect a different site. So in the same site of duodenum, and you compare between different animal and some animal is reduced in the villus height, yes, that one we confirm is villus atrophy. Same thing also, we have a sample of same site of the ileum, and then you find that the height is different, some is shorter. Yes, the shorter one we can consider as a villus atrophy. But you have a sample, one from duodenum, another one from ileum, then the shorter one in the ileum, that one you cannot call it as a villus atrophy. So this is important. When you talk of villus atrophy, I think at this stage, of course, there's many other factors, but at this stage, I just want to refer to the site of the intestine is very important when you come to diagnosis of villus atrophy. Okay, because villus atrophy have a lot of consequences. For example, we discussed this morning regarding the area, okay, malabsorption, so that is related with the villus atrophy. So in addition to the enterocyte and the goblet cell, which is present in both the crypt and villi, so the epithelial lining also consists of this Paneth cell. Okay, I think people sometimes quite not appreciate of this cell, but you are not familiar, so not worry so much. But please take note that because this cell actually is eosinophilic granules, they are located really at the base of the crypt, and more importantly, the excretion of lysozyme. So lysozyme is very important, what we call antibacterial agents. So they can cause lysozyme. And many times I mentioned the entire epithelial lining of the intestine is normally replaced every 3 to 5 days by continuous shedding of the cell from the tip of, shedding of the cell, of course, from the crypts, move to the tip of the villi into the lumen. Okay, and mitotic activities are present at the crypts, where it produces continuous supply of new cells that progress up the villi, where the mature cell before degeneration and necrosis are being seen. Okay, and any question on this? This is just a bit for you, a quick reference for you, because in the lectures I didn't put really step by step, but this one is really to see what actually the historical as well as gross structure of the intestine. Okay, and I mentioned about the microvilli, mentioned about the cellular organelles. Unfortunately, I don't have I don't have the slide for this one because this is more on histology. I screwed in the slide. But in large intestine, okay, in large intestine, you still see the enterocyte, and the number of goblet cell is more increasing. Yeah, and of course at the same time, in terms of the muscular wall, they are also quite more thickened. The transverse on longitudinal muscle. Because in the first lecture, I mentioned that in the intestine we have the epithelium, submucosa, then you got muscularis mucosa, and then you have the longitudinal and transverse muscle. Okay, thank you. So postmortem change, I think during the postmortem class, I mentioned to you regarding the postmortem change. In this case, Well, this one is more specific. That in case that you want to study the intestine, intestine is so important, particularly in terms of process of absorption and so on and so forth. And people always thought now gut health is very important. You know, gut health, you need to have a healthy gut, mean healthy intestine. By doing so, you have a healthy animal and probably also offer quality animals. So diet and then maintaining the healthy of the GIT is so important. And this include the use of prebiotic, probiotics, yeah, rather than to use of antibiotic. So when we study the intestine, of course, we want to do the morphology. Normally we put a sample normally prepared in 10% buffer formalin. Yeah, you feed in buffer formalin. Remember the ratio during the dose of necropsy class, range of 1 to 10, for example, 1 part of the sample, 10 part of the formalin. Why we need buffer? If we use only formalin is possible. We need buffer because to reduce the artifact. Normally, if the formalin is not without the buffer, when you histology, there's a tendency that the nucleus also will stain darker. So there's an artifact. And sometimes, if you look properly, you thought it's more of inclusion body, intranuclear inclusion body. Actually, it's the buffer without the buffer, just a what you call normal formalin without the buffer. That's important. And then when you look back again, remember during the necropsy class last week, dry class, intestine also are very easily get autolysis. They are very easily get changes. The nature, because the epithelial lining is simple columnar epithelium, they have direct contact to the lumen, which comprise a lot of microorganisms and enzyme. So they can undergo autolysis very fast. So meaning that we need to do a special technique, or you have to do very quick sampling. You are thinking about to see the morphology or histology changes in the intestinal wall, the villi or maybe the crypt, particularly the villi. So that's why when we talk about necropsy, we have routine necropsy, routine technique. You just routine technique. But another one is that you need to do a specific technique. Specific technique means that they really specifically into the organ. When you suspect that the disease actually really in the intestine, so you're focused directly to the intestine. Although in routine technique, intestine might be the last organ to examine because they might cause contamination to the other organ. Yeah. So that's why in necropsy, last week we mentioned when you do necropsy, one of the important aspect is that you must able to know which one is routine technique and you need a specific technique. Yeah, specific technique means for GIT, really the GIT, focus on that. Although in normal situation, you just do a routine technique. So this is regarding postmortem. Another important aspect of necropsy, I need to emphasize here also, before you graduate, at least you have experience and probably, if possible, competence in doing necropsy, at least for this group of animals or species of animal. The first one, ruminant. You must able to do necropsy in ruminants with a routine as well as specific technique. The second one, you must able to do a necropsy in non-ruminant, okay, which is also by routine as well as a specific technique. And the third one, you must able to conduct a necropsy, if possible competence, in doing necropsy in avian. So again, nobody might not, you might have those purple books. The purple books might monitor you. But more importantly is that those purple book actually the main objective is to ensure that you are competent. And sometimes you in terms of monitoring, not that very good, but you have to put your self-assessment that you must be competent on at least doing necropsy in ruminants, non-ruminants, as well as the avian. With a routine technique, as well as with a specific technique. When you talk about specific technique, we are referring to those 10 body system of the animals. So meaning even when you have one case, you can do the routine necropsy, first thing you can do. But then after that you have to do a specific examination or necropsy technique. So you have 10 body system or animal that you're able to use at least for one animals, you know. You get me? If you are 4 of you in a group, so you can do the routine, follow up by special examination, which is actually comprised of 10 body system. Okay, for example, endocrine, how to examine endocrine. Lymphatic system, how to examine the lymphatic system. Cardiovascular, how to examine cardiovascular. Nervous tissue, how to examine the brain and spinal cord, and those peripheral nerve. So this one is something that you have to keep inside you, so that when you have chance to do necropsy, you tend to know what you try to look for. Yeah, what you try to look for. Without any guide, without any forcing or anything. You got the carcass, straight away you see, oh, this is for example, dogs. So it's a non-ruminants. So I'm going to do a routine necropsy. Then at the same time, I have to learn those of the specific necropsy for the 10 body system. So those hours that you have in postmortem room, for example, 2 or 3 hours, is become meaningful and become useful. Okay, apart from, of course, recognizing of the lesion, recognizing the postmortem change, recognizing the agonal change, and recognizing the artifacts. Can you follow me, class?
Yes, Prof.
Yes, can you follow me? Yeah, that information is given to you in the those necropsy. Yeah, the information there. What I'm trying to do is that I give you some information there, but more importantly, I want to build up your understanding and build up your knowledge. What you try to look for, because my main concern actually is for you to look for knowledge rather than you are only receiving a knowledge, because you are veterinarian. You are going to be a veterinarian. Look for knowledge is so beautiful, because anything that you observe, anything that you gain, you appreciate so much. And will start your critical thinking and so on and so forth. But you receive a knowledge, it's very painful. Yeah, because you have to remember. I think you need to remember, but those to remember thing is a very painful process, you know. So you are going to veterinarian, you want to be a good veterinarian. So it's very important for you to know what you look for. Now you learn. Of course, since you are student, you need to know. So you to recall back whatever, because you need to sit for examination. So don't worry about the second part. This one. This is regarding the sampling. Yeah, you have open method and closed method. And in testing, actually, the best method you should use is a closed method. Unfortunately, I can show you because we have no hands-on class. Yeah? But don't worry, they are not that very critical. But we come to a point where you might later on study the intestinal tract, because intestinal tract is so important. Healthy gut is so important. In terms of production and healthy food, everything is from the food, yeah? And animal will ingest that. So this is a technique that you are going to use, particularly when you want to study the morphology of intestinal tract, where you need to ligate the proximal end, then you have to infuse 10% formalin into the internal content, then flush it back away, and you have to put second ligature placed on the distal and formalin, and then further inject until it's settled, achieve about the normal origin. So this will be very good to preserve the epithelial lining of the villi. Okay, the result is so good. and the tendency to you to get a finger-like projection is that. This is quite further, yeah, but in case in the future, I just want to share with you because believe me, even in the future also, we very importantly need to have a healthy gut. In this slide also, but I don't show you here, they have also artifacts. We mentioned about artifact before, isn't it? In which that you can see that there will be more obvious finger-like villi, contrast villi morphology irregular, varied in finger-like projection, but they are also like tongue, dome shape. This can be seen actually under histology, but also you can see also under the scanning electron microscopy. And in the intestine, a part of the defense mechanism, they have quite a number of lymphoid aggregate, lymphoid aggregation. And this lymphoid aggregation usually present at submucosa, and it can be big. So if it is in ruminant and ruminant, they call it as pear patches. Pear patches. So these pear patches comprise a lot of mononuclear cell, a lymphocyte over there. And the role of these patches is so important, particularly during infection, because actually pear patches, their role is to defend mechanism against infection. But at the same time also, the agent, particularly viruses, that cause infection through a GIT route, their target organ actually is a pear patches, meaning that when animal consume, for example, foot and mouth disease virus, they travel oral cavity, they travel to the esophagus, travel to the stomachs. Then at the end, of course, in the stomach, in the esophagus, there's some pear patches there. They're in the intestine. We just spoke about intestine now. So in the intestine, the target for this virus actually attached is the pear patches. They enter the epithelial lining of the cell, epithelial lining of the intestine, where they have a special epithelial lining there. We don't worry so much on that. Then they enter. There are two possible mechanisms. One, they thought that cell from their patches will protrude into the lumen, then the virus will attack to that monolymphocyte. But some they mentioned that the virus might enter into the intercellular space of the cell, and they enter to the lymphoid cell in the pear patches or lymphoid aggregate. Some say they might enter into the enterocyte. The cell which is highly modified, we allow the uptake of these viruses. Lymphoid pathogenesis. So only when they reach there, then they start to proliferate, particularly the virus. And this process of proliferation actually is to increase the number of viruses. We allow them to go to the target organ, okay, because the target organ might be far. Although you look carefully, even the target organ, for example, for foot and mouth disease virus, for example, I'll give you an example, is a stratum spinosum in the striated squamous epithelium of the tongue, okay? But the virus doesn't enter directly from the oral cavity because please remember that the striated squamous epithelium comprised of 5 layers, isn't it? Bacilli, spinosum, granulosum, lucidum, and corneum. So the corneum will not allow the virus go direct into the epithelial lining of the tongue, because the cranium is more crusty and so on and so forth. Because cranium also is like epithelial lining of our skin. They produce cause protection until unless if there are some wound or damages, so they cannot go direct. So if the tongue is normal and so the virus not able to go direct, although the virus in oral cavity, so they have to travel, and when they travel, only they go to receptors at the site actually the virus is susceptible to enter to the host. And one of the main site actually is the lymphoid aggregate. And this lymphoid aggregate, those that present in the intestine, are also susceptible. So we have those of the what we call it the peer patches. Yeah, so they enter to the they present in the lumen. They enter to the peer patches or the lympho aggregate, whether through intracellular or extracellular, or maybe people are not very sure. Protrusion of the cell from the peer patches, they will uptake of the virus or the agent. The agent will proliferate, then will follow from, we call it as primary viremia. So from that primary viremia, they go to the blood. If in cases of foot-mite disease, the virus will go into move to the stratified epithelium. They go to the stratum spinosum. So they will multiply, hydroponic generation, formation vesicle. Okay, then after that, they rupture, erosion, ulceration, and from there they also can cause infection to the other tissue. But in cases of parvovirus, for example, same thing also the parvovirus. When, for example, dogs, or in cases plant panleukopenia, the parvovirus will enter the oral cavity, then they go to the intestine. If they are also present of lympho aggregate in upper part, they might go there also, but we are focusing on intestine now. So they go one other side, they go to the intestine, then the parvovirus, what they do, again, they will enter into the pear patches or into lympho aggregate through by the intracellular, extracellular, or maybe the lymphoid cell more protrude into the lumen. They will uptake of the virus in the lymphoid cell, virus will multiply. But please remember, the target organ for parvovirus is not the stratified squamous epithelium. It's not the stratum spinosum. Their target organ is immature cell at the crypt or lubricum. Yeah, I mean in the intestine. So after they enter, again they are viremia. When they viremia, they move to the blood vessel, then the virus will attack into the enterocyte at the crypt of lubricum. Yeah, and in this case, parvovirus is more intracellular, more of intranucleus. So the virus will go into the cytoplasm, then they go to the nuclei and they multiply. When they propagate the virus in the nucleus, the presence of inclusion body, mean the presence of those virus, then they lead to necrosis of the degeneration and necrosis of immature enterocyte. So in severe case, again, they will lead to deep severe necrosis of the enterocyte, leading to damages of the blood vessel, and animal will have hemorrhage. Yeah, very severe hemorrhage. So this is seen in cases of parvovirus infection. Okay, any questions so far, class?
Prof,
Yes.
I have a question.
Can yeah.
Can I just want to know how the virus through packages. I mean, I thought packages function to protect the immune system and destroy pathogen.
Yes.
So how
Yes.
the virus entered through packages?
Correct. You thought okay. You're correct. Yes. You talk about inflammatory cell. The role of inflammatory cell actually is to protect the host against infection. Correct. Yeah. Meaning that when there's infection, that's why there will be what you call it present of inflammatory cell. But in this case, of course, the inflammatory cell is in the pear patches. Yeah. So yeah, there's a process of combating. Meaning that when the virus enter there, the cell will combat. They want to destroy the virus. If it is successful, then there's no disease, meaning that the virus will die off. And this usually occur in cases that where there is a non-pathogenic virus. Okay, but if the virus is pathogenic, so the virus are successfully combat against the lymphoid system or against the inflammatory cell. So what I'm trying to say is that when the immune cell fail to kill the virus, that's why the virus multiply, and that will lead to what we call it primary viremia and allow the virus to go to the target organ. This is the same role of the other inflammatory cell. Yeah? The role in the cell, the first part is defense mechanism, but when that defense mechanism fail, and sometimes that lead to the success of the agent to enter the body. In many occasions also, when the agent is more stronger, then the inflammatory cell will overwhelming. Those excessive inflammatory cell also could lead a negative impact to the host. Yeah, there were the formation of excess and so on and so forth. So inflammation is good if it is under control, but inflammation is not good when they are not under control anymore. Okay, they become harm and cause necrosis to the cell and might allow also the host or the agent to further enter the host. Ada soalan, is it clear? Is it clear?
Thank you,
Sorry.
Prof. Yes,
Yeah,
yes.
you're right.
Thank you,
I mean,
Prof.
you're right to understand that. Yeah, it's a very good question because yes, inflammation is for the good. Yeah, this is correct. But unfortunately, if they fail, the other way around will occur. Yeah. So that is what is happening. Any more question, class? Tak ada ya? Tak ada, we continue. So the demonstration side, I think this is we can have a look later and you can work out. What more important to me is that I mentioned earlier in the first class or so, the first practicals. So I want to emphasize again in this second practical. So my second enforcement, yeah, is that when you see, more importantly, you must able to describe the lesion, or you are able to describe the changes, or you are able to recognize the changes. That's very important, yeah, because you have to recognize, oh, it is abnormal. As I mentioned, when you say abnormal, you have to consider whether the lesion, it is postmortem change, is it artifacts, yeah, agonal change. You must able to establish that. Then when you see that, probably you can think of what type of historical changes. Maybe sometimes it's very difficult. You might not able to really appreciate until you know what you expect that gross lesion caused by. Yeah, otherwise you might difficult to expect the historical changes. But if it's possible, you look at, then you need to have your morphological diagnosis. I think morphological diagnosis we have in our first case study. Yeah, where there's a tongue there. You know how to make. I think I can see that quite are you doing very well for that. And then the second one is differential diagnosis. When we talk about differential diagnosis, we are talking about a disease. Okay, a disease. But sometimes if you're not sure what disease is that, but you are sure it's caused by some agent. For example, if a case of feline panleukopenia, feline panleukopenia is caused by parvovirus in cat. But you are not sure the disease, you can put also maybe what you call it feline a parvovirus infection. Infection is disease. Yeah? So you can put we can put either feline panleukopenia, differential diagnosis, or you can put the differential diagnosis as parvovirus infection. Yeah? And then the second one is pathogenesis. I think the pathogenesis I described earlier, how actually those of the parvovirus lead to severe hemorrhagic enteritis. Yeah, I mentioned earlier when you compare between FMD formation, vesicle ulcer and erosion, but the pathogenesis of parvovirus. The second one is also the same, parvovirus. The third one is infectious canine hepatitis. I think the lesion here, the intestine is less important, but they can cause a lesion in the liver. We'll come to liver later on. Meningococcal fever, I think you've seen on the class also this meningococcal fever. But more importantly is that this is the expected clinical sign we observe in this animal and describe the lesion. Hog cholera, tuberculosis, jaundice disease, olivibacillosis, Clostridium infection, coccidiosis. Coccidiosis, more importantly, they are involved with different sites. Yeah? Because I mentioned earlier, Emilia civilina, they only cause catral enteritis. Catral, they just produce mucus. And then Emilia tenella, they cause hemorrhagic enteritis. Okay, tapeworm infestation, and Escherichia infestation, torsion, parietal ileus, atresia ini. So all this usually you can see the slide later on, but my concern here is that for you to think critically with regard of the question that I raised here. Because my idea is that when you see the lesion, then you start to think of what type of question or what type of information that you should get or to know about those lesions. Yeah? So there is a question there. This same also those on the tutorial. That's why you do some tutorial to see those of the description. In this case, you can foresee that we are talking more, we give the history, you got the history there. And then we got the history in terms of very simple history. They say that it's a cow, it's an adult, sample from intestine, and the clinical sign they have there only diarrhea and emaciation. Those two. Even they don't mention or anything, but the information is there. You got the signalement of the animals, I mean cow, adults, you got the organ, and they give a clinical sign there. So remember, when you make a diagnosis, your diagnosis is based on history, yeah, the history given there, based on clinical sign given there, chronic diarrhea, based on lesion, in this case, given a gross lesion, which the ileum was thickened, mildly congested, while ileocecal lymph node was swollen and edematous. So in this case, what is given to you, I mean, you need to remember the concept of that principle of diagnosis, the history, clinical sign, gross and histological lesion, identification, isolation, and characterization of the agent. Okay. So for this slide, what is given actually, you are given a history, which is a adult cow, Brahman cow, and it is an intestine. And then in terms of clinical sign, animal have chronic diarrhea and emaciation. Chronic diarrhea, yeah. They don't mention about what you call it. You have to get some information. What is a classification of diarrhea, and why they got emaciated. And they give also the what you call it, they give a gross lesion, thickened, mildly congested. See that they are thickened only, no necrosis, that's thickened. Congested, but the lymph node is enlarged and what you call swollen. So they are given a slide there, describe the pathological changes and type of lymph response involved in this case. Then you ask about your morphological diagnosis from the histological slide, referential, and most likely probable etiological diagnosis. We'll see the slide later on. I think we have the slide for this. I'll show you. But more, what I'm trying to say here is that the approach of diagnosis, diagnosis based on principle of history, clinical sign, gross and histological lesion, and later on is isolation, identification, and characterization of the agent. Okay. And then the second one also the same thing. You are given the same thing. You got the history, you got the clinical sign, then you have also the what I call it the gross lesion. Yeah. In this case, coccidiosis. Number 4, also the same thing. You have the history, a clinical sign, only the body weight, and you are not given what you call not the presence of we are not given actually the gross lesion, but they mention of only the left lining of the villi. And this is Emilia. Same thing also for this case. Although I mean, in many occasions, although this is very important to practice, but sometimes also, I mean, we can foresee if you look at past year question, this type of question also will be applied during your test or even your examination, isn't it? You're given a short information with comprised of history, clinical sign, probably gross and historical lesion. And based on that, you're normally asked regarding what is your differential diagnosis, what is a pathogenesis, what is expected gross and historical lesion, what is cause of death, what is mechanism of lesion development. So that is a very common, what you call it, question you might have, you know. But when you ask differential diagnosis, you have to be very careful and read the information given to you very clearly. For example, in this case, I will give example one cause of enteritis by a dog. So it's a dog, you know. One by chicken. Another one by cattle or calf. Ruminants. Yeah? So the history of the animals is important. Because, for example, we talk about Emilia acervilena, you don't expect it to see in a dogs. Yeah? They are different. You don't see dogs with Emilia acervilena. So that's why when you see this type of question, you need to classify. Maybe you read it and then you classify what is history, what is clinical sign, what is gross and historization given, and if you got the organ agent, what agent that given to you. So when you are able to put this question in that slot, then your tendency, you focus to the right answer is much better. Any question, class? Ada soalan?
So far, okay, Prof.
Yeah, thank you. Yeah. Okay. Then of course the faculty. I think this one is we stop here, and then we can visit very briefly with regard of the slide that we have. I stop sharing first. Yeah, stop sharing, and then I'll get another new slide. Wait there. I think must be this one. Oh yes, okay. Can you see the slide now?
Yes, Prof.
This class?
Yes, Prof.
Can, okay. So you have this. So I think I explained so much on those of the our guide just now, the practical schedule. So this just to look you back at about this slide. Written there, feline panleukopenia, and this one you have feline panleukopenia also. But when you read this, you have to read also with your what you call it the practical schedule. Yeah? Maybe you need to print the practical schedule that for you to follow. Like me also, I have to print it and look into it, what they are and what type of question actually require for you to answer. And this one, canine parvovirus, okay, infectious hepatitis, melanocortal fever. I've described also during the lectures for this one. So you do your revision for this. Okay, and this one, Jaundice disease, remember, emaciated, shooting diarrhea, colibacillosis. This is a Emilia. I think I show you during the practical the class also. That one. Okay. I move quite fast. Okay. This is the first case just now. Remember the first case? Because I remember during the lectures, I don't have the full photo for this. This is a historical slide for number 1, which is small intestine of adult Bahman cow with history of chronic diarrhea and emaciation. So you can see that there's ileum actually in terms of villus projection is very less. You got musculus mucosa there. You got submucosa here. And then you can see this area within the tissue, you can see a lot of infiltration of dark staining. Yeah? Actually, nucleus of cell is this is an inflammatory cell. And this area also down here, the pointer that you can see there's also what I got. When I put pointer, can you see the pointer? When I put pointer, can you see the pointer? Can, eh?
Can, Prof.
Okay,
Can.
thank you. So you can see also, yeah, that this one, you can see this actually the muscular mucosa is a bit thickened. No? So this is a case of Mycobacterium paratuberculosis, very, very different. So when you move to the next slide, I can see that. This is the same tissue, but when you move a different side, of course, those white is artifacts, the artifact. You see that under the muscular mucosa, there's a lot of this dark area. This dark area is actually a inflammatory cell, chronic inflammatory cell, yeah, infiltrating under the submucosa of the ileum. Yeah? There, so much. Yeah. Then we further move. I think this is even you can see a lot of submucosa of the inflammatory cell, particularly mononuclear cell, but also between the lamina propria of the intestine also, you see a lot also of those inflammatory cells. Those dot black is inflammatory cell. Of course, this is the crypt albicum. This is a crypt albicum also, and this you can see mitotic cell there. Okay, so but in between you can see a lot of inflammatory cell, but of course it's much more severe under the submucosa. In the submucosa, no, in the submucosa. And then when you go to the submucosa, you can see that a lot of inflammatory cell there. But even at this stage, you start to appreciate presence of this like funny cell, that one, and this one, and this one also. We have glass slide for this. If you later on, when we manage to want to see this slide, you can have the slide from me. But of course, currently PKP, yeah, so those slide there. And I think many times during practical, when you use this slide, a student are able to identify these changes because they are so obvious. But there's a good lesson learned from this because you're at least able to identify those lesions histologically under microscopic examination. So this is what we call giant cell. Giant cell there is a cluster of macrophage actually, the giant cell. And the present giant cell is indicators of chronic inflammation, where actually the inflammatory cell try to remove the agent from causing an infection. So the formation of those of a giant cell. But don't forget, this is not giant cell. But you can foresee that also they look like a same rounding, isn't it? But this is actually is a crypt albicum. It's a crypt, when they cause transverse cutting. So you can see the difference there because you can see those of the nuclei. Then you can see the apoptotic cell there, apoptosis. And in between, of course, there's some mild infiltration of empty cell. So don't miss this, and we're saying goblet cell also. Yeah, this goblet cell. So don't miss this with giant cell. But when you go for the magnification, I think the giant cell is very clear there. This is giant cell. Yeah, you can differentiate there. You see those multinucleated cells, they're clustered together, and their role is to engulf the organism to protect from infection and surrounding. You can see a lot of macrophage and lymphocyte or mononuclear cell. Yeah? It's very typical of a chronic inflammation. Okay? And very good example of Mycobacterium tuberculosis, Mycobacterium paratuberculosis, where you didn't see abscess here. But in case of tuberculosis, you expect to see an abscess. And this again, you can see. It's in your slide also. This is the intestine of the chicken. See how the villus-like projection there is very long. And very difficult sometimes to get a very good cut like this. Yeah? Very difficult. Because this is a duodenum. We have very long villus projection. And what you see there, even in this case, you want to get a crypt also very difficult. And some, you got more than one layer. But in principle, this is how the normal look like. Although when you move to other side or probably you might move in some area, you can appreciate there are also a certain degree of coccidia, which is Emilia acivilana at different stages, infiltration of the epithelial lining of the intestine. We have this slide also. And many times also when you have practical class, a student are able to identify. This is how they look like. When you look at the area where infection occur at the villi, so of course in this case they are quite thick, because you got multiple layer of nucleus in the enterocyte. Got goblet cell there, got enterocyte there, lamina propria. But what is this? Okay, this all is different stages of the emeria. Yeah, different stages of emeria. And what they do, they are only cause infection at the epithelial lining, not even move into the into the other area. Lamina propria. They are not going to lamina, just only in the epithelial cell. That's why when you look grossly, you look only the white streak, isn't it? You remember carefully one of the slides I showed you, Emilia acivilana, pathognomic lesion, just transverse white streak on the mucosa of the intestine. They only cause catarrhal enteritis, no hemorrhage, because they are only affecting a very superficial at the side of the epithelial lining, yeah, only in the within enterocyte, not further go up and nothing to hit blood vessel or anything. And they have also very minimum infiltratory response. That's why they have what we call it more of catarrhal enteritis. But the presence of this protozoa, of course, will interfere the process of absorption of nutrient at a certain extent. And they might lead to poor performance of the broiler chicken, yeah? Poor performance of broiler chicken. And this is much more clearer. I just say there's different stages of what we call it, a protozoa or the Emilia acivilana. Okay, then occur only in the epithelial lining of the intestine. This is something in dogs which is very non-specific, but they have normally associated with condition we call it bowel disease. You know? Bowel disease. I think when you have a canine medicine that you might study, and you can see that what they have in the submucosa as well as propria, there are plenty of eosinophil. Okay, this eosinophil. You have this slide also for histologically. Anytime later on you want to have a look. After PKP, you can do that. But maybe at the moment, you appreciate first. What you need to appreciate here, of course, eosinophil. In this case, the main agent is not understood, although normally eosinophil is associated with parasitic infestation or sometimes due to the, what I call it, allergic reaction. Yeah? So this is more of eosinophilic enteritis in cases of bowel disease in adults. This again coccidia, less clearer than before. And this one is more of other additional information you have. Okay. Any question, class? Tak ada ya? Any question?
No, Prof.
Yes or no?
No, Prof.
No, okay, now kita pergi ke case study ya. Then after finish that case study, we go for our case study for that you have. 1 second. That you answer for the case study. That one you must spend more time in doing it. Stop sharing. And this I'm not sure. 1 second, yeah. This is your case study. Maybe I can go here first. Then after that, because it's here now. Hold on a second, yeah. I'm sharing with you now. I'm not sharing. Do you see anything in your screen?
No.
No. Okay. That's why I'm just not good on this. Wait. Yeah. Hold on. Yeah. Wait. Okay. Or maybe it's the latest. Since the other day I'm not good in this, but I don't know why. Yes, this one now I got it now. Can you see now?
Yes,
Case
Prof.
study number 2. Yes, this is case study number 2. I mentioned to you this case study number 2. Probably you can try later on. I think we might have, you might get better answer after we do exercise for the case study number 1. Yeah? And later, if you're not happy with your case study number 2, we have also case study number 3. But don't worry so much. You can do 2 case study also. Everything is good enough for me. Because as long as I'll see, when I see at the first case study, quite a number of you are doing quite well. So in this case study number 2, of course, they are focusing more on the intestinal tract. Same thing again. You will ask, describe the lesion. I think I described this during the lectures. You ask about the morphological diagnosis, how, what you call it, the development of the lesion, the pathogenesis, and cause of death. Same question, yeah? But of course, this will refer to intestinal tract of cat. Please remember when you got cat, what is common diseases that leading to hemorrhagic enteritis in the cat. Yeah, this is more hemorrhagic enteritis. Remember 5 type of lesion on intestine. This hemorrhagic enteritis. Then this one also same thing as well. This one also is more of hemorrhagic enteritis, but probably this one in deer. Although probably in mechanism later on you might follow about the same as the previous one. It's okay. Although in real mechanism, actually, this deer cause more of vasculitis. Yeah? But I'm not worried so much on that. So if you put vasculitis, you leading to enteritis, it's okay. But you put also as a damage of the crib and cause hemorrhages, to be fine also. Okay. And this one, of course, in pig. In this case, you can see Barton ulcer. Yeah. Where you expect to see more of exudative enteritis, yeah, as well as maybe hemorrhagic enteritis, there are amphibious enteritis. They are more combination, yeah, of this. So again, you can ask about this one to test you also our understanding of differential diagnosis. And when you and as well as a morphological diagnosis, what is different between differential diagnosis and morphological diagnosis? So differential diagnosis is more of what type of diseases that might appear can cause same lesion. And when you normally ask for most likely diagnosis, so you have to be very clear, make sure that you know what they are. Because when you ask a most likely diagnosis, meaning that that lesion is almost belong to that type of diseases. If not pathognomic, maybe they are important. Because when you talk about lesion, we can classify lesion into 3. One is common lesion. Common means anything can cause that. For example, congestion. Congestion is classified as a common lesion. So you can see anything, they can cause congestion. So it's common lesion. Then the second one we call important lesion. Hemorrhage is important lesion. Only few agents can cause hemorrhage. But they are not single agent that can cause hemorrhage. There are many agents can cause hemorrhage. That's why they're important. When you say hemorrhage, it must be caused by certain number of lesion. You compare agent compare with just congestion. Then another one is pathognomic lesion. Like in this case, the lesion is we call button ulcer, isn't it? So they are pathognomic, either by the swine fever or salmonellosis. People normally put as swine fever, yeah, although salmonellosis also in pig cause this. So when you say more likely, meaning they are almost, if not also, they are pathognomonics. They are so important. Follow me, yeah? And of course, development of the lesion. Then, of course, this cow, remember that. You examine morphology, you say also development, pathogenesis. And in this case, you ask also about mechanism of diarrhea, isn't it? So whether it is osmotic diarrhea or other different type of how diarrhea could occur. We will discuss next week the answer, yeah, when you do your exercise. So same thing in deer, but in this case you have more of necrosis, isn't it? Rather than just like before. Yeah. Then we have those cataract enteritis. Then you have hemorrhagic enteritis. Then again you have cataract enteritis. Okay. So I expect you to again to work out like we had before. Then I think in next week we're going to discuss again during the practical class. But probably for this evening we look back the answer for what you have answered in the first case study. Yeah? We discuss and go through one by one. Oh. Second, yeah, I'm sorry that currently I just doing try and error when I try to get the slide, showing the slide. Yeah?
It's okay, Prof.
I should be competent doing this, not competence. Wait first. Oh. Stop sharing. I saw just now the answer. I give it to you already. Maybe this one. Oh no. Just wait for a while. Where is it? And this one. Maybe I have to go down first. Study here. Okay, I think must be this one. Okay, so this one is Sadija. Can you see that?
Yes, we can.
Okay, okay. So we don't have a photo here, but I think we still remember how the tongue look like, isn't it? So when they ask the describe relation here, you can see that. Of course, this is our. You refer to your own answer, yeah, whether you're doing the right thing or not. I think this one they say that. I think when we do that, we have to describe relation and so on and so forth. I think that description probably now in your head. So they put describe relation there. One third apical part the tongue appear to be sloughed off. Of course, you can face slough off there. and they talk erosion or lining. You're right there. The tongue also appears swollen, right? They also reddening, indicate of bursitis. She's right also. And then there's a hemorrhage at the apical part of the tongue and indicate ulcerative lesion, correct? In erosion and epithelial lining gotten deeper until form ulcer on the tongue. I think she got everything there. I think she captured wherever we discussed during the class the other day, because to me this is models for morphological diagnosis because easy to understand. Okay, if I just doing about the same thing, so you have a right answer, 100% correct. Okay, and then when you put there, of course, when you say morphology, they talk about severity. So you got severe there. They talk about how the time of lesion development. Of course, in this case, they are not chronic. Can be acute, but probably subacute, correct? Then they talk about lesion. The lesion they have hemorrhage, yes. Erosive, yes. Ulcerative, yes. Bursitis, correct. You have all those lesions in it. So you got the severity, got the time, then you got the lesion. And the location is 1/3 apart part of the tongue. So this is a morphological diagnosis of those lesions. Right, you are correct there. Okay. So I'm happy to see that. And then we look in terms of mechanism of lesion development. Okay, you see that you put there, the lesion is caused by FMD virus. Okay, in this case, you put also picorna virus. Both are right. If you are not sure about picorna virus, you can put FMD virus, but you want to put one also is acceptable. Yeah. The only thing is that when you talk about mechanism, yeah, development of lesion, what is listed here is correct. Invade the striatum spinosum, yes. Hydropic degeneration, yes. Ruptured cytomeric fluid, okay. Then fluid accumulation, again, in this case they put a stratum corneum. Yeah, actually, they might do in start from spinosum and some also in stratum corneum. Yeah. Then they have a vesicle crack. They got erosion, rupture erosion. Then they have ulceration, hemorrhage. So easily this one is 95% correct. Yeah, it's 95% correct, but not 100% unfortunately, or maybe 90%, not 100%. Why? Of course, in this point form is very acceptable and very clear auto mechanism, because your mechanism there to describe at the end is severe subacute hemorrhagic ulcerative glossitis. Yeah. So when you talk about the agent, because when you talk mechanism of lesion, so it involves with definition of disease. Okay, we remember that disease is an adverse interaction between agent, host, and environment, leading to the entry of the agent into the host and lead to cellular changes. Yeah, cellular changes or lesion. So that might be agent and lesion. What is maybe need to improve in this case? They didn't describe how actually the agent enter to the host, isn't it? Kita nampak kat situ, how the agent go to the stratum spinosum. How actually? Okay, so agent entry is not there. So that's why might not get full marks as what is in above, question number 1, question 2. Because you have to really put how the agent, when you talk mechanism of lesion development, they must what you call it, involve with agent entry into the host, into the agent. Meaning that if the infection occur through oral cavity, probably the animal might get contact of the infected animals with FMD virus. The virus enter the oral cavity, then the virus will, that's what I mentioned earlier, whether you want to put as attached to the gut-associated lymphoid tissue, you can see the virus will attach to the pear patches or lymphoid aggregate of the intestine. From there, they multiply then lead to what you call it, residing of the virus into the target cell, which is actually stratum spinosum. So that part is missing. It's nothing wrong, but in terms of lesion development, it's not complete because you lack of virus entry to the host and to the cell. So they enter the host, they got oral cavity, they got to lympho aggregate or they pay patches, they multiply there, primary viremia, then reside of the virus in certain spinosum, correct, in the oral cavity, correct, a degeneration, then they have stratuminocyte fluid leading to hydropic degeneration, this one. Then actually the fluid is accumulated. Actually not the under stratum corneum. Maybe under, yeah, probably under is correct because actually those fluid is as a result of ruptured or stratum spinosum, isn't it? They are not say in, under, is possible. And then remnant cluster together, they form vesicle, correct? Vesicle, the stratum corneum is still intact. Yeah, that's why you put under there. Then the vesicle ruptured. That's why when vesicle ruptured, they'll damage also of the stratum corneum. Yeah? Then they form a erosion, correct? Then we progress injury basement membrane, ulcerative, they got hemorrhage, it's perfect. Okay, so what is missing only? How actually the host enter into the cell. Ada soalan? Any question, class? Can you follow me?
Yes.
No question.
Yes, Prof. So far so good.
Is all of you happy with your answer?
Yes.
Because I'm sure that okay, you improve. I just want to show you what is everything is perfect except for to improve further just the entry of the virus. Yeah, it's very good. Okay. Then the pathogenesis. Okay. The pathogenesis also, in this case, of course, there's nothing wrong here. You put after entry into the ruminant, virus replicate mucosa. In this case, mucosa, actually, again, they are lympho organ, yeah? Pharynx and spit tract leading to primary viremia, correct? Mucosa, nothing wrong, but to be more specific, what you call it, they are actually in the lympho aggregate, yeah? Then virus decay oral mucosa, particular, okay, viremia, cervical, lesion area. Okay, it is correct. FMD can cause myocarditis. Share intermical clinical sign develop, so opportunity. Okay. Okay, again, we discuss again. Because the question number, the pathogenesis and cause of death is a more reverse. Yeah? So this question number 3, just now you are talking about definition of disease, isn't it? Disease is adverse interaction between agent, host, and environment, leading formation of lesion and clinical sign. The pathogenesis also actually is how disease is formed. And at the end of the day, how those diseases can kill the animals. Meaning that you have to start with the agent, then the formation of lesion, then as a result of this formation of lesion, they cause dysfunction, organ dysfunction. You know organ dysfunction? Meaning that there will be abnormally function of the organ. And result of that, they will lead to death to the animals. Yeah? When we thought death means their failure of vital organ. So for this part, I think the answer is less specific. I want to grade, maybe you might get 6 out of 10, something like that, not very high. We compare the question number 1, number 2, and 3, yeah? Because in this case, probably is your understanding how you want to answer when you ask about pathogenesis, okay? So the pathogenesis, I mentioned earlier, when you want to answer the pathogenesis, it is exactly definition of a disease. Yeah? Pathogenesis is a pathogenesis of a disease. Yeah? Pathogenesis is pathogenesis of a disease. So meaning how disease is formed. So in this case, you might have an agent. Agent enter the host, host formation of lesion. So that actually, when it comes to formation of lesion, that actually will cover the answer for number 3. Okay, actually that part, the question number 4 is overlapping with number 3 because to the level of formation of lesion, severe subacute hemorrhagic erosive to ulcerative glossitis is actually part of the pathogenesis of a disease. So they are overlap there. Okay, overlap. Meaning, in this case, your first part of the answer is exactly as what is in the question number 3, where the virus enter the host, then through oral cavity, multiply in the, what you call it, lymphoid aggregate, primary viremia, then replicate in the, what you call it, stratified squamous epithelium, then formation of lesion. I think in this case you give there, see, after entry into the rumen, the virus, probably in this case also when you say the virus, you have to put the name of the virus. Just don't put the virus. Meaning that the FMD virus, yeah? You might be correct, there might be mucosa mentioned to you, they multiply actually in the lymphoid aggregate, but the pharynx, possible to respiratory, but more commonly also in the GIT, leading to primary viremia, correct. Then they go into the strapon spinosum, correct. Then they lead to epithelial lining, that's right, hoof also correct. But what you're missing here, you're missing the lesion actually. You get me? You're producing lesion epithelial line, but you don't mention what is a lesion, which is actually those lesions being described on the question number 3, where they form a vesicle, ulceration, erosion, and hemorrhage. It's not here. This one maybe not necessary in this case because we talk about this case, this is just additional information. Yeah, correct. FMD can cause necrotizing myocarditis, but that not been asked in this question. It's not something important in this case. You might not need to put that also. Yeah. Same thing also FMD shade in the mid. That one is, this one actually is matter of when you talk about upper part. How actually this cattle has been infected with the virus. Probably because of transmission for other infected animals. So bullet, the second bullet is not practical there. Okay. Sorry, this is nothing personal. Sajida, you are doing a very good job. You have been selected because you come first. But this is nothing personal. We are discussing. And then our main thought is how to improve. It's not an exam. We are doing self-assessment. But you are doing excellent job for question number 1, number 2, and even the number 3. Yeah? But now the pathogenesis, of course, when you go down, the down part question is much more tricky and sometimes difficult because they are not straightforward until you understand about the concept. Okay. So with regard to this, you are there, but I mentioned to you bullet number 1, number 2, number 3, this one, this is almost the same as the above bullet question number 3. Yeah? You can use that one also. But when you talk pathogenesis, I mentioned today you got the agent enter the host, the formation of lesion. But pathogenesis is a pathogenesis of disease, meaning that you have to come on and explain how actually the disease is formed. And many times when you talk about disease, there must be an agent and there was interaction between agent and host. There will be a lesion. There must be a clinical sign. So in this case, you don't come out with any clinical signs. Tak ada clinical sign kat sini. Tak ada clinical sign. Meaning that you miss one component of the answer that you should given. Otherwise perfect, but those answer not given the clinical sign. Because when you have those of the erosion, ulceration, and hemorrhagic glossitis, so that will lead to dysfunction of the animals. Particularly animal might have difficulty in eating. But more importantly, those exposed of the stratified squamous epithelium might lead to enter of pathogenic bacteria. In this case, probably you might have E. coli. So when they have E. coli, so E. coli will enter, then the animal will have septicemia. You know septicemia? There will be bacteria and blood in the blood circulation, and can cause toxic also. So septicemia is present of bacteria as well toxic material in the blood circulation. And in the long run, this toxemia will cause vasodilatation. And this vasodilatation again will cause poor of venous return. Poor of venous return because poor of cardiac output. Poor of cardiac output because low oxygen supply to the vital organ, particularly the brain, and that will lead to ischemic necrosis. Ischemic necrosis means you don't have enough supply of blood or oxygen in the organ, ischemia, and that lead to what I call it necrosis of the central nervous system, as well as probably the cardiovascular center and respiratory center in the brain. That lead to central nervous system, cardiovascular, as well as what we call it, as well as respiratory center, and cause death to the animals. Can you follow me, class?
Yes, Prof.
Yes, Prof.
Yeah. The key word is that what is needed in pathogenesis. Yeah. Okay. That's why the answer is nothing wrong, but you don't really focus on the what is meant by the pathogenesis. Pathogenesis might have those components. Might component the agent, and the agent enter the host. When they enter, they go to target cell. Then the formation of lesion because of tissue response to injury. When there's a lesion there, they lead to functional disturbances. And when it's functional disturbances, that will lead to what we call it clinical sign. And the final clinical sign is death to the animals. Okay. Please take note. If you're not clear, that's why make it very clear. Yeah. You can ask me, no problem. And then the last one is cause of death. The cause of death actually is transverse, is a backflow of the pathogenesis. Okay, let me get the answer here first. The correct, cerebral epithelium acts as a barrier, correct defense. A slough off, ulcer, correct. Then the point of entry. You have the secondary bacterium cell, that's very good there. If possible, also you have to put the bacteria, for example, most common one, E. coli. Septicemia, you're right. Septicemia is going to lead to the dilatation blood, correct. Poor venous return, poor cardiac output, correct. Ischemic necrosis, correct. Vital organ. Of course, the most important vital organ is central nervous system lah. And cause death due to secondary, correct. This is a correct answer. But I mean, your thought is correct. The flow may be not that smooth. We'll see first later on. The application of virus, intravascular viremia, systemic intake. And this one is not necessary actually, because systemic infection can take place and cause of that, correct? Because I think this is referring to the above also. Present ulcer dysphagia, yeah, this is another second possibility. Due to cause lead to inappetence, animal will suffer from correct? It will emaciated, but in this case, how emaciated will kill the animal? You are not mentioning that, okay? So the first one, I think this is much better, the second bullet, correct? But the fourth bullet also is correct. But the only thing that you don't explain actually, how actually the, what I call it, emaciation leading to death. Yeah. The only thing is that when you talk about cause death, there are actually is a reverse of pathogenesis. Yeah, reverse pathogenesis. Meaning that in this case, when you talk the concept, your answer number 2 bullet is correct, nothing wrong. You will get good mark also, but probably what expectation is that when you talk about cause death, you have to start with vital organ failure. But in this case, you end with the vital organ failure, isn't it? Meaning that the cause of death is due to the vital organ failure, the vital organ, particularly what I call it failure of the central nervous system, and the brain, the rest, because the lung is failure of the respiratory system. Liver might not be important, and second one is failure of the cardiovascular system. I think that's the important one. The respiratory system, cardiovascular system, as well as what we call it respiratory system. Why this vital organ fail? Actually, it's due to your correct ischemic necrosis. You're right. Vital organ failure because ischemic necrosis. Why they are ischemic necrosis? Because they are poor cardiac output. You're correct. Why they are poor cardiac output? Because they are poor venous return. You are correct. Why they are poor venous return? Because they are dilatation of blood vessel. Correct. Why they are dilatation of blood vessel? Because of septicemia. Yes, septicemia cause validation of those blood vessels. Why the septicemia? Because they are secondary bacterial infection. Okay, especially you can put there as a E. coli. You're correct there also. Why they are secondary bacterial infection? I think you have mentioned about the E. coli just now. Because the pathogen enter to the area of ulceration. You are correct. Okay, and why this ulceration occur? That will reverse back. You have to reverse back because the ulceration is because of presence of the erosion vesicle. Then you go back replication of the FMD virus in the stratum spinosum. Then you reverse back the enter of the what you call it FMD virus in stratum spinosum as a result of primary viremia, as a result of injection of the multiplication of the virus in the in the lymph organs, and then as a result of entry of the FMD virus from the organ cavity. This may be complete, but you want to stop also at the level where ulceration, erosion, vesicle, and so on and so forth. You want to stop at ulceration, erosion, and hemorrhage of the tongue due to foot and mouth disease virus infection. That also is good enough. You don't want to go further reverse. So when you look carefully, the answer is overlapping. Your answer here is correct. I mean, number two, you are correct. Nothing wrong. But probably against in this case, you don't name the bacteria. You have to name the bacteria because as DVM student, you cannot say it's bacterial infection. Cannot. You have to know what type of bacteria. As a DVM student, for example, sorry, Yani, I'm not referring only to you, Khatijah. Okay. Referring to all. Sorry. As a VM student, you cannot just put viral infection. You have to name the virus. You cannot see parasitic infestation. You have to name the parasite. But in worst condition, if you want to make mistake and you are not sure, of course, it's allowed that you put where the bacteria and so on and so forth, but that is a not good choice. So in this case, of course, if you think about marking, probably you might have about, for this answer, bullet 2, you might have even maximum about 8 of 10 or 8 of 10, 8 out of 10. Yeah? So meaning you're missing 2 marks. So that is not good. Although your answer is correct, but they are not really fully correct. Okay, because the missing on the concept of death. Yeah, the concept is death is okay, but not the flow is not that complete. Maybe you can get 8.5. Sorry, 8.5 per 10. Okay. It's still A, but we can further improve. Any question? Or maybe Khatijah want to say anything? You are doing a very good job. All those answers that you have. Okay. So I didn't ask your permission to use as example, yeah? But probably you are the lucky one because you have been selected. Then you can do further improvements in it. Okay.
Thank you, Prof, for the feedback. I will improve the next case.
Okay, thank you. Okay, then the second one, and then you're correct also. Yeah, number last bullet 4 tu kan. Present or ulcer lead to dysphagia, correct. They cause pain, lead to impotence, correct. Then impotence suffer from anorexia, correct. Animal will emaciated, but issue is that how emaciation lead to death? It's not there, isn't it? Okay. So probably what we can need to do, because again, the concept of death is failure of vital organ. Okay, the failure of vital organ. You know, the failure of vital organ. So in that case, when you talk about failure of vital organ, again, in this case, pending. You have to think, you know, if the animal is emaciated, animal of anorexic, probably what type of vital organ will be affected? You think that if the animal emaciated, then they might have a poor growth. And then, of course, in this case, you don't expect because they are more on the oral cavity. Yeah? Then they must lose a lot of protein. That means less protein, yeah? Protein in the body. So probably as a result of that, animal have low protein in the blood vessel. It's hypoproteinemia. So with that hypoproteinemia, what you thought is animal might have maybe severe pulmonary edema, isn't it? Because they can lead to edema when they have animal less protein. So in this case, you thought that animal might die off because of pulmonary edema. And then you start to think of how this pulmonary edema can kill the animals. And then you start to think of when the lung undergo edema, of course, they have poor gas exchange, isn't it? If the previous one, they're poor in terms of blood supply. But in this case, they are poor in the gas exchange. So if those changes in blood supply and poor in gas exchange were the same, yes, they might have same impact. When there is a poor blood supply, this low oxygenated blood flow into the vital organ. When there is pulmonary edema, poor gas exchange, there low also oxygen supply to the vital organ, isn't it? Because of poor of this gas exchange between what I call it, the oxygen and carbon dioxide. So meaning that pulmonary edema, as a result of hypoproteinemia, can cause failure of vital organ. It can cause failure of vital organ. How they can cause failure of vital organ? Partly because there will low oxygenated blood supply to the vital organ. So in this case, you want to develop as cause of death, you can move again. Meaning that the cause of death is due to the failure of vital organ. Because cause of death, the cause is really failure of vital organ. Whatever is it, for whatever reason, yeah? Whether it comes from heart first or brain first, that doesn't matter. But I mentioned to you, normally when people confirm death, they look for the heartbeat or they look for the blood pressure, isn't it? Oh, no more. Death. Of course, they can because they cannot monitor the brain easily. So either. So it's a failure of vital organ. So based on that, that's why this is more that you have to integrate information. Yeah? So if the animal is not eating in long run, maybe got poor nutrition, they got anorexia. Anorexia is right. In this case, actually, you have two terms you use there. It's very good. You have dysphagia, okay, and another one is anorexia. Those terms actually can be used also, but possibly in this case, in short term, animal have dysphagia, difficult to eat, isn't it? Because the ulcer in the oral cavity. But maybe long term, I could accept also the animal also loss of appetite. Normally, anorexia is due to the systemic infection. Dysphagia is more to the what I call it primary oral lesion. Mean the ulcer is primary, atau is due to the it might confusing later on the primary secondary. The dysphagia is due to the lesion in the oral cavity. Yeah, anorexia, you don't need a lesion in the oral cavity. You can have anorexia, but to have dysphagia, you must have a lesion in the oral cavity. I mean, we call that difficulty to eat. Yeah. So you're right there. So that's something we have to think because when they got dysphagia, what's the important? They cannot get a good diet. As a result of that, maybe they have hypoproteinemia, and this hypoproteinemia can lead to what I call it pulmonary edema, and that pulmonary edema could lead to what we call it ischemic necrosis of the vital organ. So based on that, you can come back again. Come back again means that you can see that the cause of death actually is due to vital organ failure. In this case, you think about the vital organ failure, but still you combine, probably in this case, they involve with central nervous system as well. Again, I think we still move to the main three vital organ actually. Still involved with the central nervous system and the respiratory system. I think those two is very important. Respiratory and central nervous system. Why? Again, you go back like in the first one, is due ischemic necrosis of the central nervous system. Then, why the ischemic necrosis? Because they are poor, what you call it, oxygenated blood flow into the central nervous system. Why? Because they are a primary edema. Why they are primary edema? Because they are a hypoproteinemia. Why the hypoproteinemia? Because the animal probably has prolonged inappetence and poor, what I call it, poor protein supply from the feed materials. Why they are not having that? Because they have dysphagia. Why they have dysphagia? Because they have severe ulceration of the oral cavity. And then why they have ulceration? Why you stop there? Because they have foot and mouth disease infection, or you can continue. You want to put because of ulceration, erosion, vesicle formation, or the certain spinosum due to the primary viremia, due to the multiplication of virus in the lymph organ, due to the what you call it FMD infestation from the oral cavity. Can you follow me, class?
Yes,
Ada
Prof.
soalan tak? Ada soalan tak yang lain? We actually have we have five questions, but I don't think I finished 5 questions. Maybe we can stop with one example, and we'll see first how. Are you okay with the first? And ada soalan tak untuk soalan ini for this concept? In this case, our emphasis is that satu, for you to describe lesion. In this, the model, excellent. You are doing very well. Yeah. The second one, morphological diagnosis, very well. Development of lesion also is very well, except for the entry just now. Pathogenesis, yes, the information there. The only thing that you missed just now regarding the clinical sign, isn't it? The clinical sign is not included there. Where clinical sign is because of presence of those lesion in the tongue, and then after that, what are clinical sign? Not included there. That is something that you have to add. And please remember, pathogenesis is a pathogenesis of disease. It starts from the agent. Then we have a lesion and the clinical sign until death. And finally, we have cause of death is more of reverse of pathogenesis. But very good example here, because the bullet number 1 is maybe the most easiest pathogenesis you want to establish. But bullet number 4, you need to be creative enough to think how dysphagia could lead to death to the animals. How immunization could lead to death to the animal. Because in this case, you don't have those flow. You mentioned that it became immunizated and this lead to death, but you don't put how actually those immunization lead to death. You have many choice. You're thinking about what I call it, easiest one, I give you example just now, hypoproteinemia. So that is the flow. You have maybe what I call it, poor death due to the one is due to edema, isn't it? So the edema also in certain extent could lead to also hypovolemic shock, meaning that when animal have severe edema, they might have also what you call it poor venous return, possible also. So that is the thing that you have to think and critically and see how to explain cause of death based on concept of definition of a disease. Because the death is due to the agent caused by a disease. pathogenesis is also a pathogenesis of a disease. Soalan? Class? Any question? Any question?
So far tak ada.
Sorry? Tak, so far tak ada ya? Can we stop here? Or you have another question? Boleh tanya tak? Ada soalan tak? Lagi? Probably you can, I'm very sure that later on when, or maybe what I need to do, I might go to the tutorial number, you look at the tutorial, yeah? Number 2, see how I will explain a bit later on, maybe you can pick up. Because I like to see that maybe, of course, this answer is good, not doubt on that. But of course, many times you can always improve, isn't it? It's a good answer. Thank you very much, Khatijah. Yeah? This is yours, been chosen. Start first. I'll look at the tutorial that we have. Oh, not this one. Stop sharing. Mm-hmm. I don't know which one. Hold on a second. That one, but they are not here. Wait first, yeah. Okay. Okay. Hold on a second. I'll look at the chat later on. A second, yeah. I don't know. Is this the? This is tutorial. Okay. Wait first. I look at the chat. There's some question maybe on the chat. Ui. Okay, I think it's not a question. Sorry, so it's not a question there. I got it just now, but it's okay. Okay, this is our tutorial number 2. What I need to do, I just go through very briefly regarding. Okay, describe lesion. I think you're quite good in terms of description. You want to see more detail, you can see the lecture note on the necropsy. More physical diagnosis, excellent there. Mechanism of lesion development, I mentioned earlier, isn't it? I think the same question that we have discussed just now. how actually the agent, and then up to development of lesion. In this case is a hemorrhagic enteritis. For sure, you have to put a severe, you got the subacute, then you have hemorrhagic enteritis at the middle part of the small intestine. Then pathogenesis of a disease, depend what you choose. Remember that if you talk about flammable leukemia, how the parvovirus get until the death, and then cause of death irreversible of number 4. So it's something that you have to work on that. Then same thing also in this case, describe lesion, morphological diagnosis, mechanism, same as before. Just to further emphasize, but in this case, although the real answer probably they involve a lot on vasculitis, because herpes virus lead to vasculitis. Although they can cause enteritis, but not as severe as we can see in cases of good example for the first question, which is parvovirus. Okay, same, but I want to see the flow of your answer, yeah? Then discuss the same also morphological, but we have different diagnosis there, likely diagnosis, lesion development, about the same. Same also, morphological diagnosis, mechanism, pathogenesis. But in this case, they are asking also about the mechanism of diarrhea. Please remember, you have 5 types of mechanism of diarrhea. How in this case, non-necrosis, but more of folding, transverse folding of mucosa, leading to those formation of diarrhea. Okay. And in this case, I guess about the same thing, but it's not that very important, but you put the diagnosis of the disease. I try to look, this is bacterial infection. You remember this is Mycobacterium tuberculosis. So maybe you need to refer back a bit on your bacteriology or microbiology, how actually you diagnose of this case with regard of what you call it, Mycobacterium. But more important thing, what is the message given there actually when you talk about the diagnosis? You must give the principle of diagnosis. Remember that the principle of diagnosis? You have the history, clinical sign, gross lesion, and finally maybe in this case is identification of the bacteria. So I want you to get some of your understanding on the concept of diagnosis. Because I put diagnosis there. Okay, and the previous one, I want to get you some concept of the mechanism of diarrhea. Yeah? So this is diagnosis. Okay? And then in this case, all the same. The only important here, there's something discussed on the economic losses. Okay, because we want to improve, in this case, some element of entrepreneurship. You know entrepreneurship? That's why you got some economic losses there, meaning that the what cost money losses, you know? Some element of entrepreneurship that you can think of. In this case, they might not cause death, but you look carefully, they can cause malabsorption. In chicken, probably you have learned also chicken production. So in this case, for sure, the feed conversion ratio is poor, meaning that the cost of production is high, and that might lead to what you call it, maybe some other economic losses, but some element of entrepreneurship. Okay. Then in this case, again, I'm more straightforward because mechanism of lesion development. And in this case also, you can foresee that because this is something like the question of stomatitis, yeah? Because the possible cause of death for this ascaris is not due to the direct presence of the worm in the intestinal lumen. But you remember during my lecture, in many cases, when you're in practice, normally these causes of death is due to the obstruction of the lumen. And there's so many can cause obstruction of the lumen. And one, of course, the presence of this excessive number of adults, ascaris in the intestinal lumen. And remember, in the intestine, another part is we call it as what can cause obstruction in the intestine. The instruction, you can see, you discuss, I think, our lecture, apart from enteritis, you have obstruction there. So this is an example. So this how obstruction can cause a death, meaning how the presence of caries in the intestinal lumen can cause the death to the animal, something that you have to think of. Okay? And thank you. Okay, class, ada soalan? Are you okay?
Okay, Prof.
Okay, Prof.
Okay.
Okay,
Okay.
Prof.
Kalau okay, kita ada last question tak? Ada apa question, last question? Bila I don't want to hold you more than two hours. Okay. Kalau tak ada, thank you very much for your answer for the tutorial. And I think I look at your feedback from that tutorial. You are doing well. Of course, I mentioned to you we need to improve some part, not partly because you don't understand, but maybe with regard of the flow, the flow of the answers. Sometimes, for example, just now when you talk about cause of death, the thought is not very clear. I mean, you need to be more clearer. With pathogenesis, the same thing, because you miss of the, for the example, miss of the clinical sign. Okay, because when you talk about your description, morphology is well done. Yeah? But the others are good also, but need some improvement. Okay. Ada soalan tak? Dah tak ada ya? Kalau tak ada, we leave here. Have a nice evening. But yeah, take care. Yeah? Take care. I'm not sure what is the number of COVID case today. Is announced or not? Not announced yet.
Not yet.
Not yet. Yeah. Okay. We hope that we are well, keep on healthy, and I think the issue is more of the context. And sometimes very difficult to avoid the contacts when we start to mix with each other. Sometimes it's by accidentals. So keep a distance, maybe less contact, and take care. Okay. So thank you very much, and see you on Monday. Yeah, we're going to continue our class on Monday for lecture 7, and then as well lecture 8, then lecture 9 on next Wednesday. And next day we're going to work out with. I think you submit also your tutorial like before noon of Monday. Yeah, you work it out. Do your best, but you got any problem, always ask during the class. Yeah, because currently unfortunately we don't have face to face. Sometimes quite difficult also. I don't have also chance to. Maybe you can do the drawing also, but unfortunately. Those my funny drawing are not possible also because of those limitations. Okay. So thank you very much. Have a good evening, and see you next week.
Thank you, Prof.
Thank you, Prof.
Thank you. Yeah.
Okay,
Thank you.
Prof. Stay safe.
Prof.